Hello there, I'm Dr. Samyukta. So hope you're following my Facebook videos, and I hope you're actually implementing that, and I hope you're visiting Partha Dental. Okay, so do visit Partha Dental because we doctors from Partha Dental are going to educate you more and more about your dental problems, and we're going to educate you more about the dental treatment which we render here at Partha Dental. Okay, so today I'll talk to you about bad breath. I know how bad it is to even talk about it because I know that you people are actually suffering because of bad breath. Okay, let me tell you one thing. There's a good news, that is you're not the only one who's actually suffering from bad breath. Okay, almost 50% of the human populations are actually suffering from bad breath. Okay, so you can actually relax because bad breath is one of the most common problems which all of us are actually facing it, and one good news is that there's a treatment for it as well. Okay, so first I'll tell you what is actually causing this bad breath. Okay, so one of the most obvious factor is your dental problems. Okay, so that's the reason why I'm here to talk to you about bad breath. Okay, so what are the dental problems which is actually giving you bad breath? So one of the most obvious factor is improper tooth brushing and flossing. Okay, you're not actually brushing your teeth properly and you're not flossing it properly. Okay, and when you actually know that this is the factor, it's gonna hit you like a brick wall, because I know it's very obvious but the most neglected cause. Okay, so what I would expect you to do is brush your teeth twice a day. I mean that all the dentists keep telling you, but then none of you all follow it. Okay, so I want you to follow that first, and after every meal I want you to rinse your mouth with plain water. Okay, so this is your first factor. Okay, so you are not keeping your oral hygiene checked. Second cause is your dental caries. The tooth decay is actually giving you bad breath, and your gum problems is giving you bad breath, and ill-fitted dentures and your ill-fitted crowns is giving you bad breath. Okay, and there's something called dry mouth. Okay, so it's called as xerostomia. That is actually giving you bad breath. So what is xerostomia? When there's less saliva inside your mouth, that gives you bad breath. So because saliva is one of the main factor to keep your mouth healthy. Okay, because saliva acts as a lubricant and it helps in digestion of your food, because the first digestion of your food starts inside your mouth, and if there's no enough saliva, your food is not going to get digested properly and you're going to end up having a bad breath. Okay, so if you guys come to us, okay, how we're going to help you is we're going to actually find out if the bad breath is actually caused because of your dental problems. Like if there's a decay, we'll have to fix it by filling it. Okay, if there's a dental decay, what we're going to do is we're going to take x-ray, we're going to see if filling or root canal or whatever is required, we're going to do that. And if there's any stains or if there's any gum diseases, we are going to do some process called as scaling. That is a very simple process which all of us are actually neglecting it, but then it's actually giving you a lot of bad breath. Okay, so I want you to get scaling done, I want you to get your decay checked, and I want you to make sure all your crowns and dentures, everything is fitted properly so that it's not giving you bad breath. And if you have dry mouth is again caused because of several reasons. It could be because of medications, or it could be because of some syndromes which you're actually suffering from. So for that you'll have to check your salivary glands, and you'll have to check your overall health to know what is actually causing, and you'll have to of course check your medications, like for example antidepressants and antihistamines is going to give bad breath. Okay, so the medications also can give bad breath. Okay, so now I spoke about the dental problems which can give you bad breath, but there are other reasons as well. Okay, so you're going to come and you're going to get yourself checked, and you make sure that there's no dental problems, but still you have bad breath. So what could be the reason for that? The reason are several. Okay, so the reason could stem somewhere deeper in your health issues. So what is that? It could be because of your sinusitis. Okay, so starting from here, so it could be because of your sinusitis, it could be because of your throat infection, or it could be because of your upper respiratory tract infection, or it could be because of your lower respiratory tract infection, it could be because of your indigestion. Okay, or it could be because of your acid reflux, it could be because of your liver disease, it could be because of kidney disease, and last but not the least, diabetes. Okay, diabetes actually gives you bad breath. Okay, So all these things, all your body is, getting affected, and when and every part of your body gets affected, it ends up giving you bad breath. Okay, so there are different odor. Okay, like for example, when people are actually affected with diabetes, they get fruit smell. Why so? Because when there's less glucose in your blood cells, body utilizes fat, for gaining energy. So when fat breakdowns, there's something called ketone bodies which is actually released, and that ketone bodies, when it comes out into the blood, gives you a fruit smell. Okay, and even people who are starving and people who are on ketotic diet, even they also end up having bad breath. Okay, so now I listed the systemic causes which is actually giving you bad breath. Apart from this, you have smoking, alcohol consumption, your diet. You are what you eat. Okay, so the diet what you're going to consume is directly going to affect your breath. Okay, so food like garlic and onions, I mean, that you know already. I think everybody knows about it, that onion, garlic is going to give you bad breath. So this is something which is inevitable. But then the things which you can actually avoid is alcohol, and you can avoid aerated drinks, and you can avoid using unnecessary mouthwashes, and you can have a lot of apples, and you can have a lot of lime juice. All these are going to improve your breath. Okay, so smoking, yeah, I'll have to mention this again, because smoking is one thing which affects your overall body. Okay, and I think everybody knows about it, because smoking cigarettes, cigarettes have almost like 4,000 chemicals in it, in which almost like 200 to 300 of them are cancerous. Okay, so every doctor has been stressing upon it. It's like, yeah, please make sure that you quit smoking. So these are some of the factors which is actually giving you bad breath. So I don't want you to get embarrassed anymore. I don't want your self-confidence to get hampered anymore, because we doctors here at Partha Dental are here to help you. Okay, please do visit us. First, we will make sure that your dental problems are ruled out. Okay, so because almost 70 to 80% of the bad breath is caused because of your dental problems. Like simple procedures like fillings and scalings and properly fitting your crowns will definitely make you get rid of your bad breath. Okay, so hope I have listed a few guidelines about what all might cause bad breath. So do visit us once we roll out, and once you go out clean out of a dental clinic, then you can consult your general physician to rule out your other causes. Okay, see you again.